What if one simple change could begin transforming your kidneys in just 30 days? Most people think of sugar as a threat to their waistline, but few realize how much damage it can do to the body's filtration system. Every day, your kidneys work tirelessly to filter waste, balance fluids, and keep your blood clean. Yet sugary drinks and processed sugars may place enormous stress on these delicate organs. Some research suggests that excessive sugar intake is linked to early signs of kidney damage, often long before symptoms appear. But what happens when you stop? What changes occur after just a few days, a few weeks, or an entire month without added sugar? In this video, we'll follow the fascinating 30-day journey of your kidneys and discover how reducing sugar may affect inflammation, blood pressure, hydration, and overall kidney health day by day. Before we explore what happens when sugar is removed, it's important to understand the damage excessive sugar may cause. In a large clinical study involving more than 9,000 adults, researchers found that people who consumed 2 or more sugary drinks per day had a significantly higher risk of developing albuminuria. Albuminuria occurs when a protein called albumin leaks into the urine, a warning sign that the kidney's filtering system may be under stress or beginning to sustain damage. The kidneys contain millions of tiny filtering units known as glomeruli. These delicate structures are designed to keep important proteins in the bloodstream while removing waste products. Over time, consistently high sugar intake can contribute to inflammation, oxidative stress, and damage to these filters. As the glomeruli become less efficient, small amounts of protein can begin escaping into the urine. This process may develop silently for years, making it one of the earliest signs that kidney health is being affected long before more serious symptoms appear. The first 3 days without added sugar are often the most challenging. As your body adjusts, insulin levels begin to fall significantly. This is an important shift because insulin not only helps regulate blood sugar, but also signals the kidneys to retain sodium and water. When insulin levels drop, the kidneys receive a different message: release the excess. As a result, many people notice they are urinating more frequently and losing water weight during the first few days. This rapid fluid loss can make the scale move surprisingly fast, but most of that early weight change comes from water rather than body fat. At the same time, the body is adapting to a reduced supply of quick sugar-based energy. This transition may trigger temporary symptoms often described as sugar withdrawal. Some people experience headaches, fatigue, brain fog, irritability, or low energy as the brain and body adjust to a new fuel source. While these symptoms can be uncomfortable, they are usually temporary. Beneath the surface, an important process is taking place. Excess fluid retention begins to decrease. Metabolic stress starts to ease, and the kidneys are no longer being exposed to the same constant demand created by frequent spikes in blood sugar and insulin. For many people, these first few days mark the beginning of significant metabolic changes that continue throughout the month. By the end of the first week, many people begin to notice changes that go beyond simple water loss. One of the most important shifts is a reduction in inflammation throughout the body. Excess sugar can contribute to chronic low-grade inflammation, which places stress on blood vessels, organs, and tissues over time. When sugar intake is dramatically reduced, the body is no longer exposed to the same constant metabolic burden, allowing inflammatory processes to gradually calm down. At the same time, oxidative stress may begin to decline. Oxidative stress occurs when harmful molecules known as free radicals outnumber the body's natural defenses, leading to cellular damage. High sugar intake has been linked to increased production of these damaging compounds. By removing excess sugar, the body can focus more energy on repair and protection rather than constantly responding to metabolic stress. Another important improvement may occur within the endothelium, the thin inner lining of blood vessels. A healthier endothelium is better able to produce nitric oxide, a molecule that helps blood vessels relax and widen. As circulation improves, blood can flow more efficiently throughout the body, including to the kidneys. This change may contribute to an early improvement in blood pressure for some individuals. While these effects vary from person to person, the first week often marks the beginning of a healthier internal environment that supports both cardiovascular and kidney function. Around day 14, many people enter a new phase of metabolic adaptation. During the first week, the body primarily responds to the absence of sugar by lowering insulin levels and releasing excess water. By the second week, however, a deeper shift begins to occur. Instead of relying heavily on glucose as its main source of fuel, the body becomes increasingly efficient at using stored fat for energy. This transition is sometimes called becoming fat-adapted. As fat breakdown increases, the liver begins producing molecules known as ketones. These compounds can serve as an alternative fuel source for many tissues, including the brain, muscles, and other organs. As the body becomes more flexible in its energy use, many people experience fewer energy crashes throughout the day. The sharp highs and lows, often associated with frequent sugar consumption, may start to fade, resulting in more stable energy levels and improved mental clarity. Another important change is the reduction in blood sugar fluctuations. Repeated spikes and crashes in blood glucose can place stress on the body's metabolic systems. When added sugar is removed, blood sugar levels often become more stable, reducing the need for large insulin responses. This creates a calmer metabolic environment that may support overall health. While individual experiences vary, the second week often marks the point where many people begin to feel that their bodies are operating more efficiently, with steadier energy, improved focus, and a healthier balance between fuel intake and fuel utilization. As the second week progresses, another fascinating process may begin to receive more attention: autophagy. The word autophagy comes from Greek and literally means self-eating, but the concept is far less alarming than it sounds. Think of autophagy as the body's internal recycling system. Every day, cells accumulate damaged proteins, worn-out components, and metabolic waste. If these materials are not removed, they can interfere with normal cellular function and contribute to aging over time. During periods of improved metabolic health and reduced sugar exposure, the body may become more efficient at identifying and breaking down these damaged cellular components. The raw materials can then be reused to build new and healthier structures. This process helps maintain cellular quality control and supports overall tissue health. One category of compounds that has received significant attention is advanced glycation end products, commonly known as AGEs. These molecules form when excess sugar reacts with proteins and fats inside the body. Over time, AGEs can accumulate in tissues and are associated with increased oxidative stress, inflammation, and age-related damage. High levels of AGEs have been linked to changes in blood vessels, kidneys, and other organs. By reducing sugar intake, the body is exposed to fewer conditions that promote the formation of new AGEs. Combined with the ongoing cellular cleanup processes, this may help create a healthier internal environment. While autophagy is not a miracle cure, it plays an important role in cellular maintenance, healthy aging, and the body's natural ability to repair and renew itself over time. By day 21, many people begin noticing benefits that extend beyond metabolism and kidney function. One area that may improve is the communication between the nervous system and the bladder. Chronically elevated blood sugar can affect the autonomic nervous system, the network of nerves responsible for controlling automatic functions such as heart rate, digestion, and bladder activity. Over time, poor blood sugar control may interfere with these signals, contributing to urinary problems in some individuals. As blood sugar levels become more stable and metabolic stress decreases, the body may be able to function more efficiently. Some people report fewer nighttime trips to the bathroom, a change that can have a surprisingly large impact on quality of life. Waking up repeatedly during the night can disrupt the body's natural sleep cycles and leave a person feeling tired the next day. When nighttime urination becomes less frequent, sleep often becomes deeper and more restorative. Better sleep can support hormone balance, improve energy levels, and help regulate stress hormones such as cortisol. This creates a positive cycle in which improved metabolic health supports better sleep and better sleep supports overall health. By the third week, many people feel that the benefits of reducing sugar are no longer limited to the scale, but are affecting how they feel throughout the entire day and night. By day 30, the cumulative effects of reducing added sugar may begin to become more noticeable. While dramatic changes do not happen overnight, many of the improvements that started during the first few weeks can now work together to support overall kidney health. One area often discussed is the kidney's filtering ability, commonly measured by a value called the glomerular filtration rate, or GFR. This measurement reflects how efficiently the kidneys are filtering waste products from the blood. Although significant changes in GFR vary from person to person, reducing factors that contribute to metabolic stress may help support healthier kidney function over time. Another important change involves the environment within the urinary system. Excess sugar intake can contribute to insulin resistance and other metabolic disturbances that may influence urine composition. As blood sugar levels become more stable, the body's internal chemistry may gradually shift toward a healthier balance. This can help create conditions that are less favorable for the formation of certain types of kidney stones. Kidney stones develop when minerals and other substances become concentrated and crystallize within the urinary tract. Proper hydration, improved metabolic health, and a balanced urinary environment may help reduce this risk. By the end of the first month, many people report feeling lighter, more energetic, and more in control of their health. While eliminating sugar is not a cure for kidney disease, 30 days of healthier habits can be an important step towards supporting the kidneys and protecting long-term metabolic health. Reducing sugar is only part of the equation. To give your kidneys the best possible support during this transition, it is important to focus on nutrient-rich foods and healthy habits. One of the most valuable additions to the diet is leafy green vegetables. Foods such as spinach, kale, arugula, and romaine lettuce provide vitamins, minerals, and antioxidants that help support overall metabolic health. They are also naturally rich in potassium, an essential mineral involved in fluid balance, nerve function, and healthy blood pressure regulation. Another helpful nutrient is citrate, which is found naturally in lemons and other citrus fruits. Citrate may help reduce the formation of certain types of kidney stones by making it more difficult for crystals to develop and grow. Adding lemon to water can be a simple way to increase citrate intake while also encouraging better hydration. Electrolytes are equally important, especially during the early stages of reducing sugar intake. As the body releases excess water, it can also lose important minerals. Maintaining proper electrolyte balance may help support energy levels, muscle function, and overall well-being. Meal timing may also play a role. Constant snacking can lead to frequent rises in blood sugar and insulin. Allowing longer periods between meals may help support metabolic stability. Finally, adequate protein remains important for maintaining and repairing tissues throughout the body. Choosing high-quality protein sources as part of a balanced diet can help provide the building blocks needed for long-term health while supporting overall recovery and wellness. After 30 days without added sugar, many people may notice improvements in hydration, metabolic health, energy levels, and overall well-being. While eliminating sugar is not a miracle cure, it can be an important step towards supporting healthy kidney function and reducing unnecessary metabolic stress. Small daily choices often lead to meaningful long-term results. Have you ever tried cutting out sugar? Share your experience in the comments below. If you found this video helpful, please like, subscribe, and turn on notifications for more science-based health tips from Health Handbook Daily.